My name's Caillin and I am the Community Engagement Coordinator at Mental Health First Aid Australia. I completed my mental health first aid training in mid-2021. For me, one instance where I've had to use my mental health first aid skills was quite recently, actually, with a friend who is currently living with an eating disorder. So initially, the signs and symptoms weren't that obvious to me. You know, it would be small things like we'd go out for lunch together and she would say that she just wasn't hungry, and then she'd just proceed to watch me eat. Or she'd make small comments about how frustrated she was that she didn't hit her daily step goal. But over time, these small things began to accumulate and became more common. And her obsession with how many calories she was consuming just made it clear that she was trying to lose weight. It wasn't until one day when I arrived at her house and I saw her crying in the corner of her room that I knew that something was wrong. And I immediately remember my stomach just dropping, and because this girl that I knew to be so fun and carefree was almost unrecognisable in that moment. So naturally, I immediately went to her side and I asked her if she was okay. I distinctly remember her sitting and taking some time before she told me that she had been struggling with an eating disorder. So when it came to supporting her in that time of need, I just knew that she needed someone to hold her and be her emotional safeguard, really. I explained to her just how brave she was for opening up to me and that there would be help available if she wanted it. I said that seeing a GP was a great starting point, and to make it less daunting for her, I offered to go with her. And I suppose one of the biggest things that, looking back, really helped her to feel comfortable enough to seek professional help was for me to encourage her to speak to her family. And I think that sometimes people just need that reassurance to know that, you know, others aren't going to treat you differently or think about you any differently because of what you're going through. So the day after we had our mental health first aid conversation, she actually called me and thanked me. And I suppose the reason why she thanked me was that she appreciated that ear, and to know that, you know, others won't think differently of her, and she just needed that reassurance. Because of that, she did actually go and talk to her mum that following evening, which was really amazing, and her mum encouraged her again to go seek professional help from her GP, who has now connected her in with a psychologist and a dietitian. She knows that she's got a long road ahead of her, but I think that now, by her taking those first steps, I think she's feeling a lot more capable to deal with it.
Anyone can have a conversation that may save a life. Everyone should know how. Mental health first aid, for anyone, for everyone.